a shark, babe, has such teeth, dear, and it shows them pearly white.
Howdy again, everybody. This is Dr. Bryan Langlois of the Pet Pantry of Lancaster County, as well as the current president of the Pennsylvania Veterinary Medical Association. And February is known for many different remembrances and holidays and things like that. And one thing it is also known for is Pet Dental Health Month. And we as veterinarians want to make sure that your pet's choppers stay as healthy as they possibly can. And it really is something that is probably one of the most overlooked things when it comes to taking care of your pet's health. Just a recent survey and data put out by the American Veterinary Dental Association suggests basically that 70% of cats and 80% of dogs probably suffer from some form of tooth issues or gum issues by the time they're only 2 or 3 years old. And that is very, very important to remember. So it is really crucial that you keep an eye on your pet's teeth. And bad teeth really in dogs and cats can lead to so many different types of problems out there, not just in their mouth, but systemically as well, both from potential bacterial infections spreading through their body from bad teeth, as well as them suffering from a lower weight, not eating as well, not processing nutrients as well, all because of the fact that they have bad teeth. So a lot of times we do overlook our pets' mouths as a source of a problem when that sometimes can be the only problem and sometimes is actually very easily corrected. Keep all of those things in mind. Now, when we talk about things that you want to be aware of as far as your pet potentially having some dental issues, obviously the big one that comes to mind for everybody is that noxious, knock you out from across the room, really bad breath. But that is only one sign of potential problems and dental problems in your pets. So we wanted to make you aware of some other things. Certainly bad breath is one of them. If you see your dog or cat all of a sudden excessively drooling and suffering from some problems there, if there's a little bit of blood potentially in the drool, and they're salivating a lot, those can be signs that there might be something going on in their mouths. If all of a sudden, when they used to play with tug toys and ball toys and things like that, they all of a sudden don't want to do that, or they try to and then all of a sudden they stop, they may even yelp or something like that, that can be a sign that something's going on with their teeth. If they are eating hard foods like they always were and then all of a sudden stop doing that, or they're dropping food, or they're kind of moving food from one side of the mouth to the other as they're eating, all of these can be signs that their teeth are potentially bothering them. You may also notice that your pet, normally they had no problem with you petting around their face, petting around their head, and all of a sudden they get a little head shy. And that's not because all of a sudden they're afraid of you, it's they know that it's going to hurt. And so they're kind of shying away a little bit because they're concerned about the pain. That can be a sign that you want to have your pet's mouth checked at your vet. Another obvious thing that you might be able to see in certain cases would be broken or loose teeth. So certainly keep an eye out for all of those things that may be signs for your pet having some dental issues. Of course, the one thing that normally brings them into us as veterinarians is the bad breath that owners just can't tolerate anymore. But like I said, there's so many other signs that you, as a pet owner, have to be aware of to be able to take care of those symptoms. And it really is important, and we'll talk a little bit later just about how important it is to get regular dental checkups for your pets and regular dental cleanings for your pets as well. Now, you notice I'm holding a little pet toothbrush here, and there are a lot of different products, obviously, that are out there, Fresh Breath, things like that. Toothbrushes, which are very important. Certain treats and things, that are designed to help kind of keep your pet's teeth more clean than normal brushing alone. Some of them do work, some of them really are gimmicks, and some of them are kind of all part of a program that, you use to keep your pet's teeth healthy and strong and all of that. So you definitely want to talk to your veterinarian about which treats, which supplements, which potential additives, things like that are the best and the ones that have been shown statistically to work the best for your individual pet. I will say that some people will say, well, I do everything for my pet and their teeth are still horrible, and by the time they're 5 years old, all the teeth have fallen out or need to be removed. That sometimes does happen. There is a genetic component to this that we deal with in dogs and cats as well, where it's just like some people. Some people will take absolute pristine care of their teeth. They will go to the dentist twice a year. They'll floss. They'll brush, 4 or 5 times a day. They take care of every little thing, and still they have really bad gum disease or periodontal disease and cavities. Sometimes it is just genetics, because there are those people out there that don't take as great care of their teeth, and they never have a cavity, never seem to have a problem. Sort of the same thing in the dogs. We will say in dogs that usually the dogs that are the smaller breeds and that have more of the pushed-in faces, the pugs, the bulldogs, things like that, tend to have more of the dental issues that we see that we correct earlier through extraction or requiring multiple cleanings. The other thing in cats that I wanted to make everybody aware of is a very, very painful condition called feline resorptive lesions. And this, as you can see in the picture right here, is where actually part of the tooth, or usually right around the area where it meets the gum or just below the gum line, just starts to erode away. And this is incredibly painful. If you notice your cat not wanting to eat all of a sudden or shifting food to one side of the mouth to the other, that is a sign that there may be resorptive lesions going on there, and you definitely want to have that checked out. Sometimes you may notice their gums chatter a little bit when they're eating, and that again, that's a reaction to the incredible pain that they're undergoing when these things happen. And the only solution for it is to actually have those teeth extracted. So you want to make sure that if your cat is showing any of those signs, it is very painful and you owe it to them to get to your vet and have those teeth extracted. So we talked a little bit earlier quickly just about some of the things you can do, kind of keeping your pet, well with the cleanings and the brushings and things like that. And one tip that we always give is if you get them as a puppy or a kitten, start very early. Start messing with their teeth a little bit. Start just running your fingers along their gum lines. Start getting them used to having their lips lipped and stuff like that. All of that stuff will help when they're older, much later, and you actually do have to brush their teeth to help keep them clean. Now, obviously, as far as brushing, you can use a toothbrush like this. You can use a finger brush. You can actually even use some gauze just wrapped up on your finger. It really is the mechanical abrasion that we're looking for to really kind of help and break some of that stuff off and keep that tooth clean, especially right at the gum line. So you can start with 1 or 2 teeth at a time. If you are going to use toothpaste, very, very important, only use toothpaste that is approved for pets. Do not use human grade toothpaste when you are brushing your dog or cat's teeth. The content in it can actually be toxic to your pet. So you only want to use toothpaste that has been approved for pets. Remember all that stuff. And you can talk to your veterinarian about the proper brushing technique and some other tips to get them and keep them pearly white as possible. Some people now ask, they say I need to bring my dog or cat in for a cleaning every year or every 2 years, depending on, the teeth. And I don't know exactly what happens. All I know is that I bring my dog or cat in and they say they have to knock them out and anesthetize them. And, they'll have to be there all day and then they're going to come back and maybe some extractions will be done. But I don't know exactly what happens. Well, you're in luck because we are going to show you right now what goes into a major dental cleaning that is considered average and routine now throughout the veterinary industry. Take a look. Okay, before your pet undergoes a full dental cleaning at your vet, he or she will of course have a full exam done and perhaps even some blood work as well to ensure that he or she is healthy enough to undergo the anesthesia needed for us to do the procedure. Our pets obviously will not lie on their back in a chair with their mouth wide open for us as vets to do what we need to do to perform that proper dental exam and cleaning. So a short period of general anesthesia is generally needed for a full dental cleanings to allow us to help keep your pet's pearly whites shining bright. You're getting that one final check by your vet before anesthesia is started. He or she will get a catheter placed in a vein in their front leg, and an injectable anesthetic agent will be administered, as you can see happening to River here. Once she has been anesthetized, a tube will be placed into her trachea to allow us to both protect her airway and administer inhalant anesthesia for the remainder of the procedure. He is also being hooked up to intravenous fluids that will help keep her hydrated throughout the procedure. A technician diligently monitors her vital signs with the help of a pulse oximeter. Once everything looks good and she is in a safe plane of anesthesia, the dental will begin. First thing that will be done is a quick visual inspection of each tooth, and your vet will make notes as to the problem areas that might be noticed. Next, radiographs are taken of all teeth to look at the tooth root structures below the gum line. This is to make sure that there are not issues your vet can't see with the naked eye, as oftentimes there may be problems with a tooth that can only be seen on radiographs. After that, any hard concretions of tartar that we call calculus will be cracked off the teeth if it's present. Next, an ultrasonic scaler will be used to remove any other lightly adhered calculus and tartar from the teeth. Once all of this is removed, your vet will look to make sure there are not any deeper pockets of infection or periodontal issues using a probe that measures how deep the probe can be pushed under the gum line. If the probe goes deeper than it should, further examination of that tooth will often be done. Now that all of the teeth are cleaned and scaled, if there are any that need extraction, this will usually occur at this time, with your vet taking care to make sure all of the root segments from each tooth are removed and any further cleaning out of debris and/or infection is done. Sometimes your vet may suture close the openings the tooth roots were in to prevent any food or debris from getting into them and causing infection. These sutures are almost always the type that will dissolve on their own, so you don't have to worry about bringing them back to have them taken out. Finally, after all the cleaning and extractions are done, a final polishing of the teeth is done. This helps smooth out any micro abrasions on the enamel that may have occurred from the scaling. Sometimes a protective gel will also be applied to the teeth to help keep them healthy and the gum line as good as it can be. Once all of that is done, any other medications such as pain medications and antibiotics may be given, and your pet is gently woken up from anesthesia, with that fresh from the dentist clean feeling in their mouth. So I hope that helped kind of explain a little bit as to exactly what goes into a dental cleaning. As again, it's used pretty much just like an instrument like we have here at the Pet Pantry, just a normal dental unit and the same type of dental equipment that you would actually see at your, your own dentist's office. It's very much the same equipment. We attack things the very same way. And yes, we do need to anesthetize them for these types of cleanings because they have to stay still. And in order for us to do the proper work, to get the proper dental x-rays, all of that stuff, really, they have to be under anesthesia, and we use the safest anesthesias out there. And of course, if your pet's older, we will go through some blood work and make sure that your pet is, stable for anesthesia, and also potentially start some medications beforehand if need be. But it really is important, especially if your pet is prone to dental issues and dental diseases, that you have them checked and cleaned regularly. And some people will say, well, that's a lot of money. I don't know if I can afford that. Well, you may be in luck, because did you know that pet insurance oftentimes will cover those types of things? So you definitely want to check out pet insurance. You're going to hear me harp on that in a lot of these videos and the importance of pet insurance. And you certainly can take a look right here at Pet Plan, which is the one that the PVMA endorses and wants everybody to take a look at. And if you use that cool little promo code that you're also seeing right up there, you will get 10% off if you sign up with pet insurance online. That's not all. If you do that, a portion of your sale, or I should say a donation, will be made by Pet Plan to the Pennsylvania Veterinary Foundation's Animal Care Grant Fund. And so that's just another wonderful thing to remember when it comes to those types of things. So it's a win-win-win. It's a win for you, it's a win for us, and it's a win for the animals in need. So just remember during February, Pet Dental Health Month, that it is important to make sure that you check your pet's teeth year-round. And it's not just something that should be done in February, it should be done all the time. And if you notice any of the problems that we saw, contact the only person that has the most up-to-date, accurate, and best information for you to properly take care of your pet's teeth, and that is your local and trusted veterinarian. If you have trouble finding one, contact us here at the Pennsylvania Veterinary Medical Association. You'll see the info right at the end of this video here. We'll be happy to hook you up with one. I'm Dr. Bryan Langlois, the president of the Pennsylvania Veterinary Medical Association and the medical director of the Pet Pantry of Lancaster County, wishing you many great smiles and healthy teeth for years to come. We will see you next time with another great pet health tip.
Oh, the shark, babe, has such teeth, dear, and it shows them pearly white. Just a jackknife has old Maggie Heath, babe, and it keeps it out of sight. You know when that shark bites with his teeth, babe, scarlet billows start to spread.